Hi and welcome to Hoxton Therapy. This is a narration of one of our articles. Teen mental health problems during COVID-19 calls for attention. Mental health problems confronted by teenage populations during the pandemic, which includes social media impact and online learning platforms, are being planned to be explored by a major research project. It has been launched after serious warnings about the disproportionate impacts of lockdown, loneliness, isolation and family rows on the teenage population. Childline Counselling Service of the NSPCC charity responded to have been contacted by thousands of children who reported to be feeling anxious, depressed, sad, having low self-confidence and poor self-esteem during the pandemic. The research being led by Mohn Centre for Children's Health and Wellbeing at the Imperial College of London is set to engage 5,000 teenagers after all schools and universities were shut in March when lockdown began. The centre's dictator, Professor Muriel Toledo, said, "For most of us, the pandemic has meant increased screen time since the work, study and socialise primarily throughout our computers and phones." Close quote, open quote. For teenagers, chances to engage in physical activities have decreased, leading to proportionate decrease in socialising with friends. Close quote. Teenagers' vulnerability. Closures of schools and social distancing are likely to have a large impact on the behaviour of young populations generally. And because adolescence is a developmental period with changes in biology and brain functioning, teenagers are highly vulnerable to poor mental health during the pandemic. Professor of Psychology at Nottingham University, Ellen Townsend, positions that there was increasing evidence stating that the lockdown has had dramatic influence on education and the mental well-being of teenagers, and this impact may well be long-term. Andrew Fellows, NSPCC spokesman, opined that the pandemic has had a huge effect on children's mental health. Childline receives calls from youngsters daily stating how they are struggling to cope. And as well as dealing with the post-lockdown, the changing restrictions will be adding to worries and uncertainty feelings. Exam result saga. Rosanna Alenkhan, the Minister for Mental Health, recalled that uncertainty over children's education, social isolation, and the exam result issue have had badly left young people devastated, making them feel rather uncertain about the future, about what the future holds, or what their tomorrow brings. The debilitating effect of the uncertainty on the mental health of young people should not be taken with levity. With self-harm, suicidal attempts, eating and sleeping problems on the hike, the governments need to get on top of the problem and provide an immediate and lasting solution. The Department of Health and Social Care spokesman mentioned, open quote, "We're currently committed towards providing everyone's mental health, and we urge those experiencing difficulty to seek support at the NHS has adapted many of its services for the COVID-19 pandemic, which includes the use of digital services more often." Close quote, open quote. There will be a tremendous expansion in the mental health services by 2023/2024 because of the 2.3 billion investment, and that will see to enabling at least 2 million more people getting access to the services by 2024, close quotes. Fear eruption, children calling in. In the last 6 to 7 months into the lockdown, Childline has received more than 37 online counselling sessions with teenagers and children about mental health. At the height of the restrictions, children complained of feeling trapped and overwhelmed, sad, and worried about their schools, friends, families, and parents' jobs. As the COVID-19 forced families to spend more time together, some children reported struggling with domestic conflicts and problems. They also feel worried and anxious about the pandemic, worried what a member of their family will be exposed and hospitalised because of the virus. As the lockdown began to ease, children's worries decreased to academic works, exams, and school life over again. Never act on any advice given in these articles, videos, or audios. Always seek professional help before acting on anything you read or watch or listen to on this website, or in our podcast, or on our YouTube channel, or anywhere on our social media.